All right, I'm Dr. Paul Ruff at West End Plastic Surgery, and we're here back to talk more about some of the skin issues, common things that we face. We're here with Bonnie, Norah, Kelly, and our moderator, Erica, who does all of our social media. I want to do a little bit of follow-up from one of our last ones. We talked about just kind of general skincare products. One of the most important things we touched on was consistency, but also having a relationship with an esthetician or a nurse skincare provider, seeing that person on a regular basis. And that can mean, 2 or 4 times a year, to be able to adjust your skincare regimens, especially with the changing environment here in the DC region, from arid to humid, less sun, more sun. I think those are little important adjustments that need to be made. So having a good relationship can keep your skincare as precise as it should be. Actually can help control costs, since you're not navigating so many variables. And you'd be surprised at what good products actually cost versus what you'd spend in a drugstore or a Sephora or one of those other places, just randomly trying to pick what may be best. So that's just a quick follow-up from our last conversation. But today, we're really going to dive into something that is on everybody's minds. It's getting a little bit sunnier. I'm loving seeing more sun in the morning, and definitely being able to walk the dog later at night and feeling it's, we're not shrouded in darkness. And that's SPF. Or sun protection factor. I think it's something that we think of only in summertime, but really should be a year-round part of our skincare regimen. So SPF is exactly what it says. It's sun protection factor. We see it on the different products that we purchase, but there's a lot that actually goes into SPF. When we look at an SPF 30 versus a 15 versus a 50, there is a percent of the sun's rays that get blocked. An SPF 15 blocks about 93% of the sun's rays. An SPF 50 blocks about 50% of the 99% of the sun's rays. And when we're talking about what that means, it's really the redness factor. How long does it take you to get red? So if it takes 15 or 20 minutes for your particular skin type to get red, the SPF just increases that by that factor. So 50 times more than that would be an SPF 50. But that doesn't mean that you can just put it on and let it go. And we'll approach that at the end of the conversation. But more importantly is really understanding what different sun rays are and what actually gets blocked. So Kelly, I'm going to let you talk a little bit about the different types of sun rays.
Yes, so when we think of our SPF, we immediately want to go to a broad spectrum SPF. And the importance of this is because there are 2 main rays that were affected by the sun, the UVB rays and the UVA rays. And the way that I tell my patients to remember these 2 rays is the UVB stands for burning, such as it's going to affect the epidermis. It's going to affect the outer layers of the skin. That's where you're going to get your burns, your redness. When we also think of the SPF number attached to your SPF that Dr. Ruff just went over, like an SPF 15 versus an SPF 30, that is only referring to the protection against UVB rays, which is why it is important to then make sure it says broad spectrum protection, because then you're going to be protected against the UVA rays. And when I talk about UVA rays, I tell my patients, UVA equals aging, A for aging. This is the ray that's going to penetrate much deeper into the epidermis. It's going to affect the collagen. It is the aging ray. So we want to really make sure that our SPF protects against those rays. Now, in talking about both of those rays, we need to make sure that we're protected also, because both of those rays can cause a higher risk of skin cancer. So it's important to be protected against both of them because of that too. So that's the difference between the rays when we're thinking about how we want to protect ourselves.
Awesome. I like that that UVA versus UVB differentiation, aging versus burning, because that's really true. The redness is really what we're looking at from a UVB standpoint, and that's where the SPF comes in, and that's really only what it attaches to. It attaches to the UVB ray, whereas the UVA ray, which is what causes our tanning, is equivalent to damage and the aging and that DNA damage that leads to a tan, but also leads to collagen deterioration and also risk of skin cancer. So as we try and protect ourselves, there are components that we want to be looking out for. Bonnie, as far as the different components, what is it we're really, really interested in those products?
Well, it's really understanding the difference in the actual sunscreen. We hear physical versus chemical. And one of the things to keep in mind, a chemical sunscreen actually works. It absorbs into the skin, and those ingredients help absorb the rays before it can cause damage to the skin. Whereas a physical sunscreen, or what could be referred to as a sunblock, shields the skin. And it's important to know that a physical sunscreen contains the only FDA approved ingredients, which are zinc oxide and titanium dioxide. And I think in the past, chemical sunscreens were very popular because since they do absorb, they leave a nicer finish to the skin. But more and more you see physical sunscreens coming out with either a universal tint or a micronized zinc formulation so that you get a more aesthetically pleasing finish.
Yeah, so not that old the nose
White.
white from the surfers or the
And that's exactly
Yeah.
what it is, the zinc stick for the nose. They've micronized that and broken it down so you get that full protection, but it still looks, you know, cosmetically appealing.
Yeah, so and there are many sunblocks that actually have both components to be as broad spectrum as they can be. And one of the things that I always tell patients is when you're looking for a sunscreen, especially one that does have a physical barrier, you want something that's at least 5% zinc or at least 5% titanium dioxide, because that's a critical number in ensuring that there is as thorough protection as you can be. And so that kind of gets us to, you know, what products are out there that we feel give us that best level of protection.
Well, there's both over-the-counter and medical grade or pharmaceutical grade sunblocks, and both can be very effective. The key difference between medical grade and over-the-counter is the percentages of the active ingredients, the zinc and the titanium dioxide. One of our favorites at the office is Elta MD. One of them has up to 9% zinc and 7.5% of the titanium dioxide. CeraVe is a great option for over-the-counter. It has a little bit lower percentages, but you know, we have to continue to use them on a regular basis and reapply. And Dr. Ruff will touch base on when we have to reapply.
So one of the other ones I like is Water Babies. Adult sunscreens are really meant for adult skin. Pediatric or children's sunscreens are formulated specifically for children, but adults can use those too, but not vice versa. Like I would not put an adult sunscreen on a child just because of some of the components and chemicals that are carriers along with that. But the pediatric sunscreens and Water Babies is one that I've always liked and will recommend to patients and people who have sensitivities on their skin. It's a good one. So the reapplication is a big issue. If you're going into the water or you're just out in the sun and you're sweating and those sorts of things, an SPF of 30 or 50 doesn't mean you truly have 30 to 50 times the protection. Most people will say that reapplication every hour and a half to 2 hours is really, really important, and on dry skin, and allowing it about 15 minutes to absorb and get into your skin before you can reassert that level of protection. And I think that's absolutely critical. And the more active you are, the more frequently that may need to be. There is a little study in 2015 from the Journal of JAMA Dermatology, the Journal of American Medical Associations, the dermatology section, that showed that a very significant portion of the population really didn't know how to read a sunscreen label. And so that's, I think, something that we really need to understand. Broad spectrum means UVA, UVB, and I think that's absolutely critical. Being able to look at the components and seeing that it is either a physical and or component chemical barrier, I think is also critical, and looking at the relative levels of those, the 5% level for the physical, the titanium and zinc. And 2.5 and 2.5 each does not equal 5. It's actually 5% of each one. Looking at water resistant for very water resistant. Water resistant means it will stay water resistant for up to 40 minutes. Very water resistant, it means will stay in place up to 80 minutes. And so understanding that as well. And I think those are really key. And then finally, there are all kinds of options like a stick, a gel, a lotion, a cream, and sprays, which have become very popular. I think there are times when each of those is really valuable. If you have really dry skin, a lotion works really, really well. I think that, or if you're doing broad, large areas, a lotion distributes nicely, it absorbs a little bit better. I'm sorry, not a dry, so just large areas. But if you have dry skin, particularly on the face or other areas, especially after maybe a procedure, a cream really works well and hydrates a lot better. On hairy areas, gels work extremely well. They get beyond the hair-bearing areas and down to the skin a little bit more effectively. Sticks are great for noses and lips, and I think those should be just a standard for everybody. And then sprays are very popular because they tend to be easy, but they can be inhaled, and that's not good either. So making sure you're not in a windy area or downwind. But they are good for reapplication. So if you're finding yourself in an area where it's not easy to carry certain things, a spray is great for a quick reapplication. So I think that's a good primer on SPF, especially on the threshold of summer. I hope everybody feels like they can be outside. It's nice to have a little bit of vitamin D production, but doing it in a smart way is tremendous. And if you have any questions, don't ever hesitate.
I have a question.
Oh, yeah, Erica, excellent. Our moderator has a question.
So I would say a lot of my makeup, when I buy it, it says like SPF 30 or 15. Would you say that's good enough? Do I need to put sunscreen on before that? Or yeah, what's your take on when makeup has like SPF in it?
I'll let our panel of experts weigh in on that.
Well, I think it's subjective to the patient. If you're talking literally about walking to your car and then walking into your office and you're at your desk all day, do I think that's enough? It can be. If you commute, and commuting can be walking to the metro station, a 20-minute walk to there and then to the office and back home, then you definitely need to have that double layer of protection in SPF. And if your makeup has it in there, that's great too.
Just an added bonus.
And then there's also, I've been seeing like at Sephora, they, in like the sunscreen section, they have like SPF sunscreen that's just strictly powder. Is that just as good as a lotion? Like I know Supergoop makes a tinted powder that's just like SPF, I think like 50 or 70. Would you say that's just as good?
Those are gaining popularity, especially in the summertime for an oily skin where you're producing oil throughout the day. That's going to really help mattify things and help with your oil production and how that shows through.
What I would say is good if you
more
want to
protection,
apply
the
that in addition to your sunscreen.
Yeah.
Absolutely.
The powder is
I would always say apply first your regular sunscreen, and then you can apply the powder, and then the reapplication of powder is much easier, so that would be convenient. But I wouldn't recommend that as just your only SPF because you can't actually see how much you're putting on, and so you might miss something.
Agreed. I think that's always a question that comes up as well, is when do I put my sunscreen on, and do all your skincare products, then your sunscreen, and then any makeup or powder after that. That will be the final layer. And if that has a little bit extra, it isn't an additive effect. It's not like you have a 30 in your basic sunscreen and a 30 on your powder or whatever your makeup is. Now you don't have 60. You just have a little bit more of a solid base of that that will keep that 30 in place a little bit longer. But if you're active, if you're out and about, if you're doing things, you definitely need something that's more water resistant, ultra water resistant, or sports based. And those are the times when you definitely want to reapply on a more regular basis.
and wear a hat.
And wear a hat. Exactly. We don't want any skin cancer. We want beautiful skin long term. There is nothing like beautiful skin that says, I'm not nearly as old as I am. All right, excellent. Thank you all so much. We look forward to seeing you again. This is Dr. Paul Ruff, Bonnie, Kelly, Norah from West End Plastic Surgery. Come see us with any questions. Email us at info@westendplasticsurgery.com. Follow us on Facebook, Twitter, etc. We look forward to seeing you again.